Hi, it's Robin from the Robin O.C. Girls Show, and I'm here with Dr. Estelle Toby Goldstein, and she is what they call the Renegade Doctor. Now, why do they call you the Renegade Doctor, and what is your specialty?
They call me the Renegade because I don't play by the rules. I've been through so many specialties: general and neurological surgery, neurology, psychiatry, pharmacology, study of prescription drugs. But I am the renegade mainly because I tell patients the truth. I don't much care what drug companies and hospitals and government agencies and such say. I tell people the science as I know it, and I fix them.
That's wonderful, and that's what people need to hear. So what changed you from traditional to alternative medicine?
Asking questions about why I did the things I did, which had too darn many problems coming from them. People with side effects, interactions of meds. Is there another way to do that? Answer is yes, there is, and I had to look some. Also, my own health. I had a crisis. I had to fix it. Mainstream medicine couldn't. I did.
And what was your crisis?
Not knowing I was diabetic and finding myself in the intensive care unit in a diabetic coma.
Oh my goodness. Well, that's pretty serious. Now, how did you become a diabetic?
Same way everyone does, by not noticing. The wonderful American high carbohydrate diet and perhaps a little bit of genetic propensity. But the bottom line is it happens to a lot of good Americans without them knowing, by eating and continuing in life and getting older and heavier.
Now, it seems like obesity is linked to type 2 diabetes. Is that true?
You better believe it. Some people call it diabesity because the same thing happens to both folks at the same time.
Well, Dr. Estelle, you're a doctor and you had diabetes, so what did you do?
Wake up and think. I started listening to my patients, who give me more data than any researcher would ever have. And I found out when people came to this country from other countries, they all started getting overweight and diabetic.
Yes, that's true.
From my own grandmother from Europe to people from Mexico, it's the same thing. So the first question I asked is, what's going on in the food supply? Before I saw enough scientific research to answer it, we live on processed foods, other people don't. I pretty much kicked out processed foods and the weight started coming off within
wonderful.
3 days
Really?
of trying to replicate what my grandmother had eaten before she came to America. So after that, I saw more and more research and realized that the problem is the American diet. Part of it is supplementation that we need. There are things that we need that nobody who makes food is thinking of.
That's true.
I would say the crucial one was omega-3 fatty acids, which no one has enough of. I've been taking fish oil now for, good 20 years or so.
You were taking it before everybody heard about it.
I had a heck of a time finding it and understanding what it was doing.
That's great.
So it starts with that. There are other supplementations. Some people come and they're literally addicted to sugar, and this has other reasons for being. So individual people need different plans of supplementations and of dietary changes.
So how are you helping others individually?
I do seminars.
Okay, that's
I do
wonderful.
seminars like crazy. People who want to come to my website. I'm fairly easy to get along with person.
Yes, you are.
I mean, what can I say? It's like you got a friend who's a doctor. You're talking over the best.
I like that. So, Dr. Estelle, what type of patients do you normally treat?
Frustrated ones. I want to see people who aren't getting what they need to be getting from their treatment. I will do whatever it takes and stop at nothing. I will order blood tests or whatever tests we need. I will go back over tests that have already been done. I will go back over the diagnosis. I've seen a lot of people stuck in the wrong diagnosis. most frequently missed in those who've been psychiatric patients, thyroid problems, problems with blood sugar, but even frustrated cancer patients have come to me. I want to help people get past the barriers that have been imposed by fixed thinking from the insurance, from the doctors, from all of that, and bring them into health.
So you are here to help people.
That's the only thing that counts.
That's wonderful. Well, you have a great heart, and all of Orange County would really appreciate your help. So I think you can touch many people's lives.
Heaven knows I'm going to try. I just want them to know they have a friend who's a doctor who'll hear what they need to say.
Oh, that's great. Well, thank you so much for being here, Dr. Estelle Goldstein. We really appreciate it, and we've really learned a lot from your conversation. So Orange County will be very proud.
Well, thank you. You honor me, and I couldn't think of a sweeter, more wonderful lady to introduce me to Orange County.
Oh, that's wonderful. That's so nice. So thanks for watching the Robin O.C. Girl Show.